Hello everyone, I am Dr. Ria and welcome to my channel The Lady Dentist. We help you to master dentistry and progress a bit every day. Accidental extrusion of sodium hypochlorite in patient. Root canal is an essential part of general dental practice. So, sodium hypochlorite in various concentration is widely used as an endodontic irrigant, but it can be irritant to vital tissues. So, this video presents signs, symptoms, treatments, and prevention of damage related to sodium hypochlorite extrusion to the apex during root canal treatment. I would like to share the result of a recent in vitro study that shows the most effective irrigation regimen is 5.25% of sodium hypochlorite for 10 minutes. Starting with the signs and symptoms that one can encounter during accidental hypoextrusion. At first, your patient will immediately complain of severe pain, burning sensation, and profuse bleeding from the root canal. Then the patient experiences redness over the affected side of the face along with swelling and edema. After few hours, signs of ecchymosis or even paresthesia can occur in severe cases. Next is treatment. The treatment should be started as soon as possible to provide symptomatic relief to the patient. Abort or stop any further dental procedure. Immediately, first and foremost, you should proceed with negative aspiration using the same syringe of the affected area. After that, lots and lots of forceful irrigation of the canal with copious amount of saline or lignocaine solution has to do to neutralize the effect of hypo to some extent and reduce the pain. By doing this, the exposure time of the nervous tissue to the irrigant agent is also reduced. If the sudden onset pain suffered by the patient is really intense, then perform re-anesthesia of the affected area. To reduce the edema of adjacent tissues, prescribe analgesics like steroidal and non-steroidal anti-inflammatory drug. Then corticosteroids can be added to reduce the localized inflammation. Antibiotics in some cases of medically compromised patient can be used to prevent secondary infection. The routine use of antibiotics is often controversial and they should be administered only if there is clinical evidence of wound infection or if necrosis is expected. Advise the patient to use cold packs or ice packs extraorally during the first day in order to prevent swelling. After 24 hours, it is advised to use warm compression and frequent warm saline mouth rinses to facilitate localized healing. Healing occurs by stimulating local systemic circulation. Lastly, you can request advice or management from local maxillofacial unit. Students, all this whatever I have mentioned in treatment will just provide symptomatic relief to the patient. Hypoaccidents take their own sweet time to recover. So, at the end, what matters most is effective communication with the patient, constantly being in contact with him, and reassuring him that things will improve gradually with time. But as I always say that prevention is better than cure, to prevent such inadvertent hypoaccidents, the measures to be taken are all syringes that are used should be duly named after the irrigant it contains to avoid interchanging of solutions during use. The next point that I'm going to discuss holds a major importance. We should educate our assistant well to fill up the syringes with utmost care and they should understand the risk involved if care is not taken. It is always better to load local anesthesia yourself to avoid confusion. A good pre-endo build-up along with rubber dam isolation is a must to avoid any leakage of solution and accidental spills during use. Both patient and dentist should use protective eyewear and try to provide a plastic bid to protect the patient's clothing. Okay, so next, many a times we experience dispensing of the irrigant inside the canal from the syringe. So, it is always recommended to use side exit lure lock needle and syringes so as to avoid opening of the needle from the syringe. Irrigant should be delivered using 30 gauge side vented needle in a slow up and down motion inside the canal, making sure at any point of the time the needle should always be minimum 2 mm short of the working length. Another thing we often experience during irrigation is wedging of the needle. At no point of time the irrigating side venting needle should be wedged as it increases the chance of apical extrusion of the hypochlorite solution. You should always avoid using excessive pressure during irrigation and don't forget to consider the strength of sodium hypochlorite that you use. So guys, this video will gonna help you at your most critical time. So please don't forget to subscribe and hit the bell icon.